So this is a brief teaching video on how to use the Resuscitaire and what it's used for. The Resuscitaire is a piece of equipment used for the resuscitation of newborns after delivery if required. It's not commonly used in the emergency departments, thankfully, but it's a potentially life-saving piece of equipment if we need it. So the purpose of this video is just to take you through and familiarise you with the Resuscitaire itself and how to use it and set it up if we need it. Once baby is delivered in the department, if baby's crying, pink, active and healthy, then the baby can go straight onto mum's chest and we shouldn't need to use the Resuscitaire. But if baby looks in any way unwell, floppy, blue, isn't crying, we would immediately cut baby's cord and bring baby over to the Resuscitaire. One of the scores that we use when babies are born to assess their condition is the APGAR score. So it stands for Appearance, Pulse, Grimace, Activity, Respiration. As you can see, depending on each of these areas, the baby is scored 0, 1 or a 2. So ideally you want baby pink all over, with a fast pulse, crying and active movement, okay? So if you're finding that baby isn't any of these things, then you can bring them over onto the Resuscitaire. The APGAR score is scored at 1 minute and 5 minutes, and if the baby is still unwell at 10 minutes, they scored again at this time. An APGAR score between 8 and 10 is a healthy baby, and anything below 8 is a bit more concerning and you would want baby on the Resuscitaire. So if baby is scoring between an 8 and 10, they're healthy to go onto mum's chest. Okay, the Resuscitaire first of all does need to be connected to the oxygen and plugged in. Once you've done that, you can switch it on at the top here with the black switch. You should hear it turn on. We turn on the light here at the top so that allows us to see baby, and we turn on the heat on manual down here. So there's a heater that brings this heat down onto baby. We turn that onto manual, and if we need to turn it up, we turn it up to 100. So sometimes it's set less than that, so you can use this dial to turn it back and forth. The next thing that we need to do is connect up to the oxygen. So you'll see here there's what we call elephant tubing. So it's just simple tubing and a mask for babies connected at the bottom. So we pop this onto the gas outlet here, and we turn our oxygen on this side up to 10. You should be able to hear the hissing of the oxygen coming through the mask, but to check that it's working properly, you occlude the bottom of the mask there and you should see the pressures increase so that you know the gas outlet is working. You don't need to keep this on consistently, but it's a good way of checking before baby's born in case you need it. Okay. What you want to have laying out is a sheet underneath, so an ankle pad type sheet, a baby sheet and some towels for when baby comes out to dry baby. Obviously once baby is born, if you do need to bring them over onto the Resuscitaire, you actually want baby's head at this angle, so I'll just show you the way that you would bring baby onto the Resuscitaire. So you would lift baby with head at this side, okay? You would dry baby off with the towels and you can place a hat over their head. If you're needing to use the oxygen supply, obviously like I was saying, turn it up to 10. You can press the mask over baby's mouth and nose with their head in a neutral position, and you occlude the top side to provide oxygen to baby. Okay. Inside the Resuscitaire pack, there is the Resuscitation Council guidelines for newborn resuscitation. Obviously a lot of people won't be familiar with this, so if we get an unlikely scenario that we do get a baby born that needs resuscitated, these are available with everything that comes along with the Resuscitaire to kind of guide you through and what you need to do and how to assess. Okay, thanks for listening.